Welcome to the neutral posture. This video explains how to achieve a neutral posture while standing and sitting at your work area. A neutral posture helps maintain work efficiency and reduces stress and strain on the muscles, tendons, and skeletal system. This in turn reduces the risk of developing musculoskeletal disorders, also known as MSDs. Let's start with standing and begin at the base. If you are in a standing position, have feet about hip width apart, knees slightly bent, keeping hips level. Maintain a relaxed spine in the natural S-curve shape of the spine. Elbows close to the torso and open 90 degrees or more. Wrists straight. Shoulders relaxed and back. Head straight and chin tucked slightly. It can be difficult to stand in one place and hold one position for an extended amount of time. To help alleviate this, you can shift your posture throughout the day. Remember to vary your posture during prolonged tasks. A foot rail or foot rest can help change your posture while standing. While we work, our focus is usually on the work, not necessarily our posture, so often there can be multiple misalignments at the same time within our body. Let's dive into these issues in more detail. Full extension or hyperextension of the knees. Locking the knees can restrict the amount of blood flowing back up to the heart and can cause dizziness, lightheadedness, and even fainting. It also puts more stress on the joints than if the knees were slightly bent. Shifting weight to one side, hiking one hip up, and locking out one knee. In this example, one hip takes on almost the entire burden of bearing the body's weight, while disengaging the muscles meant to assist with the load. This creates more wear and tear on the hip joint, and the uneven hip stance takes the spine out of a neutral position, which can lead to low back pain and stress on the vertebral discs. Blood flow can be restricted by the knee joint locking out, putting more pressure on that joint since the surrounding muscles are not fully engaged. Excessive curvature of the lower spine. Standing with an exaggerated lumbar curve means your abdominal muscles are not helping support your weight. Your back is doing all the work, which puts more pressure on the vertebral discs and can lead to low back pain and fatigue. Chronic back pain is one of the most frequent complaints of office workers. Occasional back pain can quickly turn into chronic pain if we cannot maintain our neutral posture. Extreme wrist angles such as extension, flexion, ulnar deviation, and radial deviation can lead to problems with the wrist and hand. Let's take a moment to talk about this further. Carpal tunnel syndrome is a common condition affecting the wrist and hand. It can appear in people who use their wrists and hands in repetitive motions over long periods of time, particularly if the hand is bent or twisted. These repetitive movements include typing on a computer keyboard, repetitive and forceful gripping of objects, such as a supermarket checker, or using vibratory tools such as an air drill or jackhammer. Let's break this down. The carpal tunnel is a narrow passageway surrounded by bones and ligaments on the palm side of your hand. Muscle tendons and the median nerve pass through this tunnel. The median nerve controls the muscles in the palm, thumb, and nearby 2.5 fingers, allowing them to move. Carpal tunnel syndrome is a condition where the swelling of tissue causes pinching of the median nerve. This pressure on the nerve can begin as a tingling sensation and progress to other symptoms such as pain, numbness, and general weakness in the hand and wrist. In many cases, carpal tunnel syndrome can be prevented by eliminating repetitive motions, taking appropriate breaks, periodic stretching, and using a relaxed posture. Next, let's discuss what happens when the shoulders are rounded forward and the chin juts forward as well. This rounded shoulder position shortens the muscles in your chest, leading to tightness and stiffness in the front body. This position can strain the neck muscles and lead to tension and headaches. Stand up tall and pull that chin in. Now, what about sitting in your work area? The upper body positioning is the same as standing, so in this scenario, let's look at the lower body. Feet should be able to remain fully flat on the floor or supported by a footrest. Knees at approximately 90 degrees, at or below hip height. There should be 1 to 2 fingers width from the edge of the chair to the back of your knees. Some of the common issues that may arise include When feet are not fully on the floor or footrest, there is a loss of stability for supporting weight and keeping proper spine alignment. When feet are not properly placed, hips and spine can both be out of alignment, leading to a myriad of potential injuries, including low back pain. When seated, if the knees are above the hip joints, this causes extra tightness in your hip flexors and can lead to rounding of the spine, adding pressure and possible discomfort in the lower back. As you can see from these examples, it's important to be mindful of your posture throughout your workday. A small shift can make a big impact. Remember to vary positions and focus on working with a neutral posture. If you have any questions related to ergonomics, feel free to contact our consultants. Oregon OSHA consultants are looking forward to providing your company with free and confidential consultations that will not result in citations or penalties. Please visit osha.oregon.gov/consult. If you have any questions about this course, please call 503-947-7443 or email us at ed.web@dcbs.oregon.gov.